Cardiac electrical activity can be monitored by using an electrocardiogram or ECG. Electrocardiography uses an electrocardiograph to record electrical activity of the heart over time. And there's proper way of placing the leads if you're doing an ECG. I think this picture shows the actually proper placement of the leads. There's also another picture that you can see or view in the ATI book. But over here, you have to place the leads in the right arm, left arm, right leg, lower leg. The V1 and V2 are positioned on the fourth intercostal space. The V3 lies halfway between the V2 and V4. The V4, V5, and V6 should be placed along the horizontal line, and this line does not necessarily follow the intercostal space. Before we move further to the topic, I think it's also better to review the flow of the blood going to the heart and out. So again, the blood enters the right atrium, then the blood passes through the tricuspid valve, then it goes down to the right ventricle, then after that, the blood flows through the pulmonary valve, and then blood goes to the pulmonary artery, and then it goes to the lungs for oxygenation, and then the blood returns to the heart via pulmonary veins. And after that, the blood enters the left atrium, and then the blood passes through the mitral valve or mitral valve. Then the blood enters the left ventricle, and after that, the blood flows to the aortic valve, and then the blood enters the aorta and then circulates all throughout the body. This picture also shows a recap of what we learned in NUR 226 nursing assessment last semester. So again, it is the locations that we're trying to listen for the heart sound. So we have the aortic, pulmonic, Erb's point, tricuspid, and then mitral valves. Again, for the aortic, S2 is going to be greater than S1. Pulmonic, S2 is also greater than S1. And then Erb's point, S1 and S2 is going to be equal. Tricuspid and mitral, S1 is going to be greater than S2. The other two sounds that we need to be aware of are going to be the S3 and S4. So S3 is going to be the abnormal heart sound in adults. When present, it occurs in early diastole, immediately after S2. It indicates the end of rapid ventricular filing. Then, the other hand, S4 is an abnormal heart sound, and if it's present, it occurs just before S1 at the end of the diastole. I think this is a good picture of the EKG strip. So again, we have to remember that the big box over here is equal to 0.2 seconds, and then the small boxes inside the big box is 0.04 seconds. So again, if you multiply it by 5, it's going to be 0.2, and then the whole 5 big boxes is equal to 1 second. Also over here, you can see that how to read the rhythm of the EKG. So we have the P wave, the QRS complex, the T wave. Again, there's a lot of heart rhythms that are available for reading, but we're just gonna cover down the basic ones. Again, if you want to learn more about the other complicated heart rhythms, you can go to the SkillStat website for more information. So the first heart rhythm is normal sinus rhythm. So if it's not normal sinus rhythm, most likely it's a form of dysrhythmia. So if somebody has a normal sinus rhythm, the heart rate should be around like 60 to 100 beats per minute. The rhythm is regular. There's a P wave before each QRS, and they're identical. And then the PR interval will be 0.12 to 0.20 seconds, and then QRS is less than 0.12 seconds. The next one is going to be the pulseless electrical activity, or PAA. The rhythm in this one will be a regular or irregular. The rate is any, it can be fast or slow. QRS could be narrow or wide. Then P waves and PR interval will be visible, normal, including sinus in origin. Alright, third rhythm will be the sinus bradycardia. So on this rhythm, it's going to be less than 60 beats per minute. It's regular. There's also a P wave every before each QRS, and it's identical. The PR interval is going to be 0.12 to 0.20 seconds, and then the QRS is less than 0.12 seconds. The fourth one is going to be the sinus tachycardia. So this one originates in the SA node over heart. Then heart rate is greater than 100, and then the rhythm is still regular. P waves similar, sometimes stall and peak. Sometimes the P waves are partially hidden, and then it has a normal PRI and QRS complex. And lastly, this is a picture of other heart abnormal rhythms. So we have the first degree atrioventricular block, Mobitz type 1 and type 2, and then the third degree atrioventricular block.